Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. As coronavirus cases in Nigeria races to the 40,000 mark, we'll bring you insights from the National Coordinator of the Presidential Task Force on COVID-19. Enugu State Government addresses malnutrition, focuses on children and, of course, mothers in the face of the pandemic. And state schools in South Africa to close for 1 month from Monday. We'll tell you why. Now, global figures from the coronavirus continues to rise, with cases now at over 15.5 million. That's according to the Johns Hopkins COVID-19 Resource Center. The top 5 countries are the United States, Brazil, India, Russia, and South Africa. In Nigeria, COVID-19 cases now nears the 40,000 mark after the announcement by the Nigeria Center for Disease Control NCDC last night, reporting 604 new confirmed cases and 20 deaths. Till date, 38,948 cases have been confirmed, 16,061 cases have been discharged, and 833 deaths recorded in 36 states and the Federal Capital Territory. The 604 new cases are from 21 states: Lagos 203, Oyo 87, the FCT recording 79 cases, 41 in Edo, 35 in Osun, 24 in Ogun, 22 in Rivers, Kaduna 22, Akwa Ibom 20, Plateau recording 18, Delta 9, Ebonyi 9, Imo 8, Enugu 5, Kano 5 as well, same with Cross River, 4 in Katsina, 3 in Nasarawa, 2 in Borno, as well as Ekiti, and 1 in Bauchi State. Now, Bauchi State Government is raising the awareness on how to prevent the spread of the coronavirus in the state. At an awareness campaign, members of the Bauchi State Task Force on COVID-19 took to the streets, also engaging stakeholders with a message on the importance of wearing the face mask in places of worship and businesses in the state.
It has now become mandatory for each and every one of us to use masks in the offices and in places of interaction, government interaction, and people are encouraged to personally, even at their homes, at their places of worship, at their places of businesses, not even government offices alone, to use masks.
Now, ahead of the school reopening, the Northeast Regional Initiatives, they have made donations to 3 junior secondary schools burned down by Boko Haram insurgents in Gaidam, Local Government Council, Yobe State. The schools received free textbooks and furniture. The program officer, Mr. Buka Kurama, says the aim is to improve and enhance access to education for all students in the insurgency-affected areas.
As we are all aware, this is one region in the Northeast that has suffered a very serious setback in the education sector as a result of the ongoing insurgency in the northeastern part of Nigeria. And with this intervention, we are very optimistic that the quality of education and access to quality teaching and learning materials has been increased, and the school management as well as the local education authority of Gaidam have shown a very serious appreciation for this very timely intervention and have assured us that it is going to be utilized efficiently as it is required.
We have seen many things done by many organizations, but that of NERI is of paramount importance because they are directly or indirectly helping the students, and most especially school activities are based on or they focus on students-oriented project.
Over in Enugu State, the government has reiterated its commitment to tackling malnutrition amongst children living in the state and ensuring the well-being of mothers, especially during the pandemic. The government made this known while inaugurating a team of professionals, including representative of UNICEF, to review nutrition programs and advise government on formulating appropriate policies and programs on nutrition in the state. The committee is also expected to establish a multi-sectoral plan by increasing spending on nutrition intervention, promoting maternity protection in the state, among others.
Your duty will also include establishing a multi-sectoral nutrition plan by increasing spending for nutrition intervention and promoting maternity protections. This is very important, especially now that coronavirus is ravaging the globe, and there is need to build the immunity of the population through the establishment of this committee of people with various backgrounds, both in the civil service, academia, civil society organizations, to tackle the issue of nutrition with seriousness.
Now, over in the southwest, following the closure of religious centres, which is until another month in Ekiti State, the government has commenced preparations for the reopening of schools. The state government announced August the 3rd as the day for resumption of schools, but insists that this will only happen if it is satisfied with the level of adherence to preconditions and preparations put in place by the schools. Well, right now we're being joined by Dr. Sani Aliyu, who is the National Coordinator of the Presidential Task Force on COVID-19. He joins us from our Abuja studios. We'd like to thank you for joining us on the program.
Thank you for having me.
All right, Dr. Aliyu, first, it's good to know that the Foreign Affairs Minister is in good spirits, and that's having tested positive. How are you feeling?
So, we're delighted that the Honorable Minister of Foreign Affairs is improving, and we hope he continues to improve and hopefully come back and join us in the next couple of weeks. I think this further reflects on the need for all of us to continue to make sure that we carry out those measures that are necessary to protect ourselves and our family. It's very clear that the coronavirus is an egalitarian virus. It has no respect for anybody in terms of position or in terms of gender or in terms of who you are, etc. And this is reflected in the fact that our own members, as we can see clearly, have been infected. And we know all strata, including people in the villages, the rural areas, the poor, the rich, etc. So we will continue to work with the rest of the general public as well as our partners to push through that message of risk communication and effective engagement of the communities. This is the only way that we can get on top of the virus, by ensuring behavioral change. This is the new normal. We cannot continue to go around as if things are completely back to normal, because they're certainly not back to normal yet.
Given the present figures of coronavirus cases in the country, are there any margin of error, more so when for every person tested, there is a certain number of those not tested who may have been in contact?
So this is absolutely true, and it's true across the board for virtually every country in the world. For every one positive you'll have a handful of positives that have not been picked up. Why? Because there's no country I know that has tested each and every part of their population for coronavirus disease. Here in Nigeria, we are upscaling testing. As you know, we started off with no lab, and then by March, we had about 4 or 5 labs that were able to test. And now we have about 59 labs across the country. Only 7 states at the moment do not have the capacity for testing. And even for those states, we are rapidly bringing them into the fold. So for instance, over the next day or two, we'll bring in Yobe, we'll also bring in Zamfara, I believe Sokoto, and it might be Taraba. But what I'm trying to say here is, yes, we are certainly not, we haven't reached the target that we would want to, But over the last 1 week alone, on average, we've tested about close to 40,000 persons. That's almost about 5,000 tests a day. When we started off with only about 500. Our target is to exceed this figure. We have now tested about 260,000 persons since we started the pandemic, but we are really looking at having up to 2.1 million persons tested over a 6-month period. We are far from this target, but of course there are challenges. Some of the challenges are within our power of influence to change, and we are working on that. But there are also challenges as well that have to do with engagement of the public. So in the north, for instance, we know most of our laboratories are not operating at maximum capacity because the demand is just not there for these tests. It's not there because people might feel that they do not have the symptoms and do not want to come forward. There's also the issue of stigma and discrimination linked to having a COVID infection. But we're tackling this. We're tackling this by improving access, making sure that we have sample collection centers in most parts of the country, including the local government areas, and also prioritizing those 11 local government areas that we've identified that have a relatively high burden of infection compared to other parts of the country.
So Lagos yesterday at the briefing, the commissioner said that it might peak in August. Any ideas as to nationally when we'll reach our peak?
So nationally, the issue is Lagos are testing quite a lot. Edo are testing as well per capita, and Gombe, followed by Kano and the FCT. But for a lot of the other states, the only way that you would have really good modeling and prediction is if you test widely and you test people that have the symptoms, people that have come in contact, etc. But I wouldn't want to give a prediction in terms of when the national rates will peak, but they probably wouldn't be too far off from the Lagos figures. We would like to do a lot more testing. If we were to test, let's say, 1 million, 2 million over the next few weeks, for instance, we would have a pretty good idea of when we will peak. But that peak also depends on people's behavior. If all of us start wearing masks now, if all of us start gelling our hands and keeping those physical distances and keeping to our homes unless we have to go out, this pandemic will disappear within a short period of time. But if we continue to behave as if things are back to normal, then it will take much longer. There's no doubt about it. There's no science that would change that at all. So it's all about behavioral change.
Do you fear that there might be a resurgence in Nigeria if the non-pharmaceutical measures are not complied with, or in your estimation, with the level of compliance that you're seeing?
So people talk about a second wave, but we haven't even been through the first wave yet. So we are not in the same category as some countries where, in Europe, for instance, and other parts of the world where they have peaked and then they are now having very few cases, and they are worried about a second wave coming up. In Nigeria, we haven't even peaked yet. So I think it's still quite, it's a bit premature to even predict whether a second wave will come. Hopefully it will not. I think what will probably happen is we will gradually peak and then the number of cases will start coming down after that. And Lagos will give us a very good idea. We're very proud of the good work that is going on in Lagos. We are also very grateful to a lot of the state governments for continuing to work with us very closely. Some of the state governments have already announced proactively the measures they will be taking with regards to the Salah holidays that will be coming up. And we'll be working with the religious authorities and the state governments to make sure that this does not represent an opportunity for the virus to suddenly escape again, and we end up with more issues than we currently have.
All right, Dr. Leo, we need to go on a break now. We'll come back. When we return, we'll talk more about the resources states are getting to fighting the pandemic. Please stay with us. Welcome back, everyone. We still have Dr. Sonia Liu, the National Coordinator of the PTF on COVID-19, with us from our Abuja studios. Just as we wrap up on this discussion, I'd like to find out about how the federal government is monitoring resources, be it PPEs, monies for palliatives or what have you, to states to fighting the pandemic.
Thank you. So just to clarify, as you probably know, we have several funding sources. So we have the public sector. From the public sector side, we have two budget lines. We have a budget line that comes, that is part of the 2020 budget that's only recently been signed off by the National Assembly, the revised budget. And this money goes straight to the ministries and the MDAs for their procurements, etc. And then from the PTF side, we have a smaller amount which comes into what we call a special intervention fund. The PTF is not a procuring body, so what we do is we sit with the MDAs and we decide on their priorities based on their budget lines, and we ask them to go ahead and do their procurement or they do their activities, and then they ask for reimbursement. At the moment, that special intervention fund, we've spent certainly less than 2-3% of that, because the majority of the activities by the ministries are still going on. They haven't reached the stage where they will reimburse us. In fact, to my knowledge, I think we've only given Foreign Affairs 250 million naira for the evacuation of Nigerians, and the security also had their money taken out directly for security reasons. But the bulk of the 20 billion or so, we certainly have about 96-97% of that at least still with us. And we are running a very transparent system. Whatever we do has to follow due process. There's no doubt about it. And we've made that very clear to the ministries. We then have the private sector. The private sector contributions go directly to the private sector. This is their money. Our role is to help them to take decisions in terms of what the priorities are. So for instance, COVID, which is run through Dangote, and the central bank, they have money that they've put towards setting up isolation and treatment facilities. At the moment, they've commissioned treatment facilities for most of the states across the federation. And they would ask us, for instance, how many ventilators do we need, how many PPE do we need for protection of our healthcare workers, etc. And we give them an idea, and we might give them quantification, and they go ahead, they buy, they deliver to the states, and the states are able to manage them. We then have another source, which is from the UN single basket. Again, that money stays with the UN single basket, both the COVID money and the UN single basket, which in total comes to a significant amount. It's at least 50-60 billion in total, stays with those entities because they are private sector or multilateral arrangements. And our role in this case is to provide them with information in terms of what government's priorities are, and to help them to take decisions in terms of the proposals that come to them. The state governments are about to get money from the national government, from the federal government. That money will come in two streams. There's a World Bank credit facility, a smaller amount, I think about 100 million naira, that some of the states have already started getting. There will be a larger World Bank credit facility that at the moment we've just completed negotiation, and hopefully that will come through. And then there's a specific amount that's coming directly from the budget straight to the state governments. It's not coming through PTF at all. We've developed a template, and we've been using this template to judge whether states are in line with the national COVID response. And I'm pleased to say we're making great progress. Even some of the states that we initially had challenges with are now working very closely with us. And I'm very confident that we should be able to sign off all the states so that the money goes through to those states, particularly for operational reasons. And the PTF is running a very transparent system. On our website, we will have full information in terms of who's donated what, when, and the amount. We don't have money coming to us directly, whether it is from the public or from the private sector, other than directly from budgetary sources. We will make that information available. We already have most of that information on our website anyway, but we'll make sure that the money that individual Nigerians and companies have provided that has gone into the Accountant General's office that information will be available on our website. It's already been published in some of the newspapers, and it's part of the agreement we have with government. And just to make it clear, the PTF is not a procuring entity. So because we receive a lot of requests and a lot of proposals from people wanting to deliver one thing or the other, and we always refer them back to the ministries and the departments. They do their procurement, they buy their commodities. Our own role is to provide oversight and make sure that their budget fits in with the national response.
All right, so you said that this information is made public on the website. Do you know the website?
So yes, so there's a State House website. I don't have the full links because it's a link, but we have provided that with our previous press briefings, and I'm sure on our Twitter handle we will make sure that that is clearly made available at the end of this program.
All right, thank you so much. Dr. Sonia Liu, National Coordinator, the PTF and COVID-19. We wish you and your team the best as we fight the pandemic.
Thank you.
Now, public schools in South Africa are to close on Monday. This is as the country passes the 400,000 mark, becoming the 5th highest in the world. President Cyril Ramaphosa says it is essential to make sure that schools did not become sites of transmission. There's more details in our global update.
State schools in South Africa will close for 4 weeks on Monday as part of the measures to combat a surge in the number of coronavirus cases. President Cyril Ramaphosa said it was important to ensure that schools did not become the sites of transmission at a time when coronavirus cases in South Africa are rising at one of the fastest rates in the world.
Half of all the cases
President Ramaphosa says the current academic year will be extended beyond the end of 2020 as a result of the disruptions caused by the pandemic.
Should take a break for the next 4 weeks.
Australia has recorded its highest daily death toll since the pandemic began on Friday as the nation's 2 most populous states increased their restrictions. Australia's second most populous state, Victoria, which recorded 6 deaths overnight, will deploy Australian Defence Force personnel to the homes of people who have tested positive and who have not answered telephone calls in order to kickstart the contact tracing process. A flare-up of infections in Melbourne, the state's largest city, prompted the government to enforce a 6-week partial lockdown and make face masks mandatory for its residents, or risk a $200 Australian fine. In the US, more than 4 million people have now been infected with COVID-19. It comes as President Donald Trump cancels next month's Republican Party convention in Florida, saying it's not the right time for that.
Thank you very much.
President Jair Bolsonaro rode his motorcycle and spoke to people without wearing a face mask in the capital of Brasilia, a day after testing positive for coronavirus for a 3rd time. Bolsonaro also spoke via Facebook on Thursday, saying he's doing very well. He says he's been taking hydroxychloroquine, an unproven treatment for COVID-19. Bolsonaro tested positive on Wednesday, July the 22nd, in the 3rd test he's taken since falling ill on July 7th. Globally, more than 15 million people have been infected with the virus, with over 633,000 deaths.
So spread the word, not the virus. Our website, channelstv.com, has the latest update on the pandemic. All you need to do is log on, access news and health, politics, business, sports, of course, news from Africa and around the world. You have the top stories there saying that over 10,000 health workers infected with COVID-19 in Africa from the World Health Organization. Channelstv.com, that's our website. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.